So my name is Debbie Welle-Powell, and I'm the Chief Population Health Officer for Essentia Health. So Essentia Health is a physician-led integrated health system that's located in the Midwest. We're in 4 states: Minnesota, Wisconsin, North Dakota, and Idaho. And in my role as the Chief Population Health Officer, I'm responsible for our care management programs, our payer strategies with purchasers, whether it's Medicaid, Medicare, and our commercial carriers, and also responsible for the community health and wellness. And so we spend a lot of time looking at the intersection of care programs that we offer to our patients inside our organization, as well as saying what are our community partnerships that allow us to build improve the health status of our community members. Yeah, when we look at the data, we look at county level data, we look at data at the state level. We're really challenged in that we live in a rural area. And when you look at the social determinants of health, poverty levels are higher in the counties we serve. Graduation rates are lower. Obesity rates are higher. Heart disease is higher. And so when we think about access to food, access to education, our community members probably have a better access to clinical care, but it's all those social determinants and behaviors that we're really challenged with as we work to make a community healthier. And so we might be able to provide care in our facilities, but it's really to improve health status. We know that that piece is more important than access to clinical care. We're certainly aware of the issues and where those issues lie in the communities we serve, and a couple of initiatives that we're working on that we're in pilot with, and one is with the state of Minnesota, and we're looking at food insecurity for our Medicaid population. And we're today at risk for managing their care of about 45,000 lives. And we know that we cannot out-doctor ourselves. We cannot put enough healthcare resources into improving their health. And so our area of focus is food insecurity. And so we're piloting in our clinics the screening process during the rooming process of registration. And we're using iPads because it's not something that you can ask a patient when they walk in a office setting, are you food insecure? There's privacy issues that we need to be very sensitive to. And so our EMR allows us to ask questions around food insecurity, transportation, and housing. And so what we're doing is for those patients that test positive or say they are food insecure, we will follow up those referrals from the clinical practice. And we have 65 clinics across Essentia. Those referrals will be given to a community health worker who will then connect those patients to Second Harvest to allow them an opportunity to have access to food. So we're testing that right now. We'll see how well that works. That's probably the number one initiative that we're working on. So we're partnering with the state on Medicaid patients. And we're excited about that because if we can make a difference, if we can really get to patients trusting us to help them with their issues, that's what we're here to do. And our mission at Essentia is to make a healthy difference in people's lives. And this is one initiative that advances us forward. And if we're successful at it, we'll start to work on other areas. So to think that we could, in healthcare, really bridge the gap between healthcare and health status, that intersection is called a community care model. And so I'm very passionate about what we could ultimately do to improve the health status of our patients. I hope that this makes a difference. My only career has been healthcare, and I love it because it's dynamic, it's forever changing, and it's about helping people. I hope we can move the needle. I hope we can move the needle on health status through what we know around the social determinants.